Hi, I'm Dr. David Tenner, and we're here with Garrett Kuzmak. And Garrett came to see us back in April of 2014 after his wife had come in to see us as well. She had gotten some great results with us, and so she referred her husband, Garrett, in to come and see us. And Garrett, tell our audience a little bit about what brought you in to see us.
Well, by my wife's prompting, I had a routine physical exam where the doctors once again detected blood and protein in my urine. Protein was higher than the blood, but that's what set her off. She was very concerned about that. Did some research online and found out that's a very bad thing to have. And then told me I had to go to the doctor, but she let me pick. And after, since she was going here, the Goldberg clinic is into healing your entire body. That's what I was by far the most interested in.
Okay. And you had some other health issues at the time as well. I know you had the blood and the protein in the urine, which is very concerning. There should be no protein and no blood in a standard urinalysis. Garrett had also had some issues with psoriasis. And how long had you been having that problem?
For 10 to 12 years at least. I started in my early 20s and now 33.
Okay, and so there are some autoimmune issues occurring with you. The likelihood is that these autoimmune issues and the issues you were having with your kidney may have been interrelated, may have been part of the same problem. So rather than treat Garrett for his psoriasis or treat Garrett for his issue with protein and blood in the urine, the goal, as it is with all of our patients, is to identify the factors that may be causing the problem rather than treat the issue, and see what we could do about getting the body functioning well, getting healthy overall, so that these issues would just naturally resolve on their own. Medically, what were they recommending for you at the time prior to coming in?
For the psoriasis, all they did were give me steroidal creams. That was it. And they also explained some complications that would eventually resolve if you use them too often. That was it for the psoriasis. And then for the blood and protein in my urine, I was monitored by a kidney specialist for 2.5 years before I finally just gave up on that. Just went in approximately every 3 to 6 months with a 24-hour urine sample just to see what had changed. It varied, but it was pretty much always about the same. And then he wanted to do a biopsy on me, and that was it, to figure out what was actually going on inside of me. He wanted to do the biopsy.
Okay, so they were recommending some pretty invasive type testing, okay, which you had declined.
Correct, because I would have to pay out of pocket for it, and inherently it didn't seem right to do it.
And the procedure itself comes with risks, which I'm sure you wanted to avoid. And so Garrett came in to work with us, and actually at his first visit, his urinalysis showed his levels of protein in his urine and in his blood were just about as high as they could get. I mean, I haven't seen him that high in just about any patient that we had worked with. And as you recall, so Garrett was the winner there, and he recalls you've had that issue for 10 years, right? 10 years.
First detected.
Okay. So we developed a program for Garrett after we sat down, got a good history, did a physical exam, and got some specific lab work on him, identified some factors that were involved. We knew there were some issues with allergy and with autoimmunity. Developed a specific program for him to start following. And actually within 48 hours, what kind of change did we notice in that urine profile?
It was fantastic. Both the blood and the protein had dropped. I forget what it was exactly. I don't know if one disappeared completely, but then there was just a trace to level 1 of the other.
Within 48 hours, we had no more blood in the urine at all, and the protein levels had dropped from 3+ down to trace. So significant improvement in just a few days after having this for 10 years. Right. Then we saw Garrett about 2 more times, and it's only been 30 days since we got started with him. At his second follow-up visit, trace blood and trace protein, so we still had a significant reduction, but still we had some issues still occurring. As of his third follow-up visit, no blood and only trace protein, and today, which is the 4th follow-up visit, a little less than 30 days after we first started, we had a urinalysis that was completely normal. And so not only has the result been consistently improved, but now it's entirely resolved. And it's just after doing some very simple things, Garrett has been able to avoid invasive procedures, invasive treatments that would have likely ruined his health over time. Now, that's not the only improvement that you've had. Tell us a little bit about what's happened systemically in terms of your psoriasis, in terms of your back pain, your energy levels, everything you were mentioning to me before.
Yeah, the overall improvements I've seen in different departments are it's really hard to believe. energy level, even, after I stopped drinking coffee, my energy level is actually higher than what it was before when I was drinking coffee on a fairly regular basis. I've had very tight back muscles for years, and I figured it was just due to sitting. I saw a chiropractor typically about once a week, got a massage for about once every other week for about 3 months. That just helped minimally. And since I've been on the plan here and gotten my system essentially cleaned out, my back muscles have loosened up to where they're no longer painful, they're no longer tense constantly, causing me discomfort. And, sorry, what was the other one?
Just overall, you've noticed an overall sense of well-being.
Yes, oh yeah, overall it's just fantastic. So,
one of the important things to mention about Garrett's case is that when he came in, he had multiple issues, which is common for a lot of the patients that come in to work with us. And oftentimes what's done medically, and even from an alternative standpoint, is that the patient will see a variety of different doctors for each different issue, as if each issue were some kind of separate and distinct problem. And oftentimes that's not the case. These issues are often interrelated, they're all part of the same problem, and when we work on getting the body healthy and functioning well overall, everything starts to get better together, as was the case with Garrett. And so we feel that's the best approach to take to help patients solve even chronic issues that have been going on for 10, sometimes 20 years or longer. All right, so Garrett, we're very encouraged with the improvements that you've had. We're going to continue to tighten up the nuts and the bolts and the screws and make sure that we've had this issue not only resolved for now, but for the foreseeable future. And also make sure that now, as we continue to work with you, that we teach you the right things to stay healthy so that when we're done working with you, you can start taking care of yourself. Do you think we've been doing a decent job with you on that?
outstanding.
Okay. All right.
Outstanding job.
All right, great. So thank you, Garrett, for joining us and for sharing your story today.
My pleasure, sir.